think about that today. We're in dead winter. We know this winter and what we're going through is going to continue for a while, but we also know there's hope, and we know that spring will come. Spring will come to Ohio and across this country, and it reminds us of how good life is and the importance of all of us doing everything we can to get through this and to move forward, that there will be a new day coming. And if Dr. Acton is right, we may even see a baby boom. We see a lot of babies born, and there's nothing more joyful than the birth of a child. So we have a lot to look forward to. I want to thank all my fellow citizens in Ohio for what they're doing, because it truly is a patriotic act, the individual things that people are doing, what people are doing to help their fellow citizens, what they're doing to stay away from their fellow citizens. That truly is patriotic. I was reminded this morning, and I know there were headlines across the state, but it's a pretty good headline. I think there's a pretty good indication what Ohioans and Americans are doing across our country. Good deeds galore. So I want to thank everyone who's been doing good deeds. We have a lot of good deeds ahead of us to do, but thank you so very much for doing that. My friend, Albert Ratner, who's in his 90s, remarkable man, called me last night and he said, you know, Mike, he says, when you're trying to grasp how to explain this to people, what we're going through, what lies ahead, he said, you might use Pearl Harbor as an example. He said, we were attacked, we rallied, we fought back, it took a while, and it's really true. We have been attacked. We've been attacked by this virus, and we're asking our fellow citizens to do extraordinary acts. We're asking them, each one, to do something, each one to do the distancing where we're pulling apart. We're asking people to make the sacrifice. Don't go on that spring break. Don't get on that airplane. Don't do all the things that we normally do. Don't go to the pub. Don't go to the bar. Don't go to the restaurant. And each one of us is making those sacrifices. And just as in a time of war, where we've been hit by a foreign country, when we've been attacked by this virus, we have to pull together. And ultimately, it's going to be these small acts, what seems small, of each and every American that truly is going to make all the difference in the world, and each Ohioan. When I came home last night, Fran said, you know, when we have a crisis, 9/11, different things that have gone on through our history, Americans have put out their flag to really show unity, to show we're not going to be pushed aside, we're not going to be conquered, we're going to be defiant. And so I'm asking today all Ohioans to put their flag up. Fly that flag every single day. If you have an Ohio flag, fly that, but most people have an American flag. Put that flag out. Fran tells me that she just put ours out on our front porch. Dr. Acton says her husband just put their flag out. And so I'd ask all my fellow Ohio citizens to do that. We will get through this. Spring will come, and all the joys of life we will again be able to enjoy. We have several speakers today to kind of give you an update of what's going on. I've asked people who really have an expertise to come in. I want to first start with the Chief Justice of the state of Ohio, MAUREEN O'Connor, and what the Chief Justice will do is to talk about the judiciary, talk about the courts, co-equal branch of government, and she will then take questions from the news media. And I would just ask that the questions be confined to the chief and to the issues, obviously, in regard to the courts and the criminal justice system. We have people throughout the state who work very, very hard, who do a great job, whether it's prosecutors, whether it's courts, clerk of courts, and we could go on, judges, and everyone. So, Chief, I'd ask you to come up and say some words and really kind of give a report to the people of the state of Ohio. Chief, thank you very much.
Thank you. Thank you very much, Governor. Thank you for the invitation to participate this afternoon. I want to thank you also for your courageous leadership on this subject. I think that you have set Ohio as an example for the rest of the nation, and we're proud. This is an unprecedented time, undoubtedly, a time when during which the judiciary of Ohio, as well as the bar, the state and local leaders must come together to guarantee the vital and continued operation of the state's judicial system and the public's access to justice. I both commend and thank Ohio's judiciary for taking action, issuing orders, and considering the health and safety of the public as well as their staff, all the while mindful of the structure and dictates of our Constitution and our laws. My intent today is to let everyone know what the courts are doing and my expectation of what they should be doing to continue operating in a manner consistent with the state's public health strategy. Last Friday, I met with the state's state judicial leadership to discuss the judiciary's response to this pandemic. After that meeting, I sent a lengthy email to all judges in Ohio. In the meeting and email, I emphasized several key points that I want to highlight today. Courts must be open to address emergency and time-sensitive matters. Indiscriminate closure of the courts with no plan for these issues is not an option. Judges across each county must cooperate among themselves to issue orders and establish procedures necessary to continue essential court functions in this rapidly developing situation and in light of the further directives of Governor DeWine and health officials. The need for uniform buy-in and consistency among judges is paramount. Further, judges need to consult and collaborate with local leaders to develop a plan to ensure essential access to the courts, that it will continue. This collaboration needs to include all stakeholders, clerks of court, health and law enforcement officials, attorneys, treatment providers, children's services, and others. These are all essential members of the operation. Total closure of the courts and the clerks of courts' offices presents an access to justice issue. Measures can be taken to ensure access to justice while safeguarding the health of employees by limiting but not eliminating access. The courts can be closed to the public for non-essential purposes. I've asked judges to prioritize their workload to reduce the need for jury pools and the level of public traffic in courthouses. I encourage them to maximize technology and to modify their orders to reduce the need for face-to-face interaction. I urge them to consider lowering bonds and using summons instead of arrest to help minimize jail populations. I noted some creative local solutions to these problems and urge courts to use their authority and their initiative to employ similar solutions. Courts all over the state have responded by issuing orders that do just that. I might add that the website of the Ohio Judicial Conference, which can be accessed from our website, sc.ohio.gov, that's sc.ohio.gov, contains the orders issued by the local courts. If you access it, you will note the response by our judiciary. For example, courts in Cuyahoga County have suspended all non-time-sensitive civil and criminal jury trials, and they've implemented a jury call-in system so that jurors would not have to appear unnecessarily. Also, when possible, hearings are being conducted by video to reduce person-to-person contact. Foreclosure actions and sheriff sales are stayed for 60 days. This will ensure that individuals are not forced out of their home during the public health crisis. Jackson County has leveraged their existing statutory authority under the Ohio Revised Code to extend speedy trial time in criminal cases on the grounds of the governor's emergency declaration. As I've advised, Ohio Revised Code 2945.72 states the time within which an accused may be brought to trial, or in the case of a felony, to preliminary hearing and trial, may be extended during the period for the period of any continuance granted on the accused's own motion and the period of any reasonable continuance granted other than upon the accused's own motion. This allows for continuances upon reasonable grounds. Judges can and should employ that provision where appropriate and issue orders detailing the reasonable grounds for the continuance. And Franklin County Municipal Court has authorized the use of recognizant bonds for nonviolent misdemeanors and traffic cases. But there's still more work to be done. Today, I want to encourage local courts to continue using their own authority and initiative to address common issues that we see across the state. For example, I urge all judges to grant continuances or use alternate methods for non-essential court appearances. Ensure that the clerk's office remains open and are accessible to the public. Temporarily stay appropriate evictions and foreclosure proceedings. Temporarily refrain from issuing warrants for failure to appear for traffic violations, minor misdemeanor, and nonviolent misdemeanor offenses. Find ways to provide remote and yet meaningful treatment options for those with substance abuse disorder. Change probation and community control and pretrial supervision meetings to phone or video reporting. Finally, I urge judges to use their discretion to release people held in jail and release incarcerated individuals who are in a high-risk category for being infected with the virus. Looking ahead, we will be working with the Governor and the General Assembly on a legislative proposal which will provide more uniformity and continuity in our judicial system's response to emergencies such as this. I must also mention the work of the Supreme Court staff itself. We continue to consider and decide cases. Although we have taken common sense measures consistent with the Governor's guidance to reduce risk, the court remains open. We have essential staff performing their duties on and off-site. We will continue to accept case filings, provide support for judges, for local court staff, and for attorneys. Finally, I understand that many local courts lack the technology and resources needed to implement many of these suggestions. To meet that demand, the Supreme Court will release funds in the form of grants to local courts to obtain video conferencing equipment. It is my hope that by pushing out this funding on an emergency basis, we can assist the local courts in a quick implementation of video conferencing for arraignments and other conferencing needs. I expect to announce the process for those grants tomorrow. We've decided on an amount of $4 million that will be taken from my budget and dispersed to the local courts for this purpose. Now, before I take your questions, I'd like to say that I have personally been in touch with many judges, the Bar Association's leadership, and in constant conversation with the director of the Ohio Judicial Conference, Paul Pfeiffer. We are working together in this ever-changing environment, and we are so pleased to continue to do so. Thank you. Now I will take any questions that you might have.
Kevin Landers, WBNS 10 TV. Can you explain a little bit more about releasing prisoners who are in the high-risk category of attracting the virus? Thank you.
There obviously are many different ages and health conditions of prisoners in our jails, and an assessment should be done to determine whether or not they can safely be released, given the fact of their age and maybe other health conditions that they might have that they have to deal with. This is twofold. One, to safeguard the folks that are in jail, and also to offer the individual who may be at risk the opportunity to be isolated outside of the jail environment. This is up to the local courts to do. This is, and in conjunction, obviously, with the sheriffs who run the jails. But this is something that I've asked them to consider.
Hi, Chief Justice. This is Molly Martinez with Spectrum News. I'm wondering if there's any push to sort of clear out low-level offenders and sort of make more room in the prisons during this pandemic.
Well, I don't speak for the prisons. I'm talking about the jails when I make this recommendation.
But will there be any leniency with the jails and who is incarcerated?
Well, that's what I mentioned, that the judges should review their bail and the circumstances by which they have people detained in the jails and prioritize releases based on that.
Thank you.
Chief, Jim Province with the Toledo Blade. There were 2 justices who have recused themselves from the Election Day lawsuit. Could you tell us how you're going to replace them in considering this case? And if you can, could you comment on the fact that you yourself are being sued over your Election Day morning decision?
Okay. Well, first of all, I'm not going to comment on pending cases. I will tell you in general, when cases are not orally argued, there is no need for a visiting judge to sit on a case. We need 4 justices to create a majority, as you well know, and as long as we have 4 justices that are in unison, there's no need to deal with the fact that we don't have 4 justices. If we did have a problem with 4 justices that would be in agreement, then there would be a need to supplement with visiting judges, but not at this time.
Thank you.
Hi, Chief. Andrew Welsh-Huggins with the Associated Press. In terms of the recommendations that you've made that you'd like to see judges and courts undertake, can you explain whether you have the ability to ramp that up at all and make an actual judicial order? And depending on your answer to that, is that something that you would take advantage of? In other words, instead of making recommendations, do you have any way to issue a directive, an order to judges to actually do these things?
Thanks for that question. You know, there's 2 different types of judicial systems in the 50 states that we have in our country. One is called a unified system, and one is what we have here in Ohio, which is a non-unified system. In the unified systems, the Supreme Court, the Chief Justice, has that type of power that you just described and can issue directives, not just for emergency situations, but many other situations that present themselves in the course of managing, you know, the judicial system in the state. We don't have that in Ohio. We have Superintendent's Rule 14, which is a declaration of a judicial emergency. This does not go as far as what you were suggesting, that there would be a pronouncement from the Chief Justice that would be binding on all judges. At least that's my interpretation of Rule 14 at this time. When I mentioned that we are looking at legislation, that's exactly what we're looking at, to create legislation that would, under very, very limited and specialized circumstances, such as what we are experiencing here, should there be a need, the opportunity for the Chief Justice to make those type of orders that would be binding on the judiciary.
Real quickly, the legislature is actually meeting next week. Are you looking at a fix that quickly when you're talking about that type of legislation?
In an ideal world, that's the way it would happen, but we're not in an ideal world, so we'll see.
Thanks.
Hi, Chief Justice. This is Jake Zuckerman from the Ohio Capital Journal. I wanted to ask about your decision against any moratorium on evictions. Is it prudent to allow the eviction process to continue in this pandemic?
Would you repeat your question, please?
I thought I heard you say that there was no moratorium on evictions. Could you clarify that for one, and is it prudent to continue to allow the eviction process to continue in this pandemic?
Well, that's an interesting question. Most people think that evictions are just for mere non-payment of your rent or whatever the situation, but there are certain types of evictions that may be, for example, domestic violence and trying to get someone evicted from the home because they present a danger to the other members living in that home. So it's up to the courts to deal with that and to figure out, yes, if there is an eviction that is in process or they could have a moratorium on filing of evictions and foreclosures in the same way. They can do that. But then again, they have to have the flexibility that if someone needs to be removed through the eviction process because they're a domestic violence perpetrator, that should be allowable on a local court's judgment and their initiative. So, you know, Ohio has 88 different counties, over 700 judges, over 350 courts in this state, and we are not, as I said, a unified state, but there's a reason, I think, maybe for that. It's because we have such a variety of communities and court systems and resources. So I am in favor of the solutions coming from the locals and being implemented by the local courts and local community leaders and officials, of course. And as a last resort, I would resort to, the contents of the legislation that I just described. Now, different mayors in the state that I'm aware of have urged that evictions be stayed, that any utilities be reinstated, or the process to terminate be suspended, and those are good practices, and those are practices that I definitely would urge.
Thank you.
Hello, Chief Justice Paul Teasley with Hannah. I'm told I'm your last question today. Apparently, Hamilton County Judge Heekin has asked you to issue a uniform order, uniform guidance in keeping with your power to, quote, do all things necessary to ensure the orderly and efficient administration of justice. And then related to that, can you speak to any equal protection concerns for potential jurors or witnesses in different counties under varying COVID-19 orders to appear or not appear in court?
Okay, would you repeat what the judge from Hamilton County would? For what purpose?
Based on a Cleveland.com article, apparently they're quoting him. He is asking you to issue a uniform order for all courts based on your power, quote, to do all things necessary to ensure the orderly and efficient administration of justice. In other words, that would be your legal authority to do so. Now, I know you've addressed Ohio being non-uniform. I didn't hear you address that precise phrase. I don't know where it appears right now. And then the related question again, what equal protection concerns are there for jurors and witnesses in different counties under different COVID-19 orders?
Okay. If there was a need, if our local judges and local leadership were not addressing the issues that presented themselves, maybe I would have to take a look at intervening in some way, but that's not the case that we have here today. There is, as I said, there's orders. You can take a look at them on the website, and you can see for yourself the type of measures that are being taken in the individual courts. And there's many, many, many of these measures that are taken in the courts to address this. And they address all kinds of situations. Primarily, they're concerned about jury pools, which points to your second question, and not having jury trials because of the health risk that imposes. The fact that you may have difficulty even having jurors report. So if the court employs the appropriate statutory authority to continue cases, there's where your authority is, and that's how those trials can be continued.
Yes, and as the state's chief legal mind, as it were, can you address the equal protection question between counties?
Okay, well, I'm not going to address an equal protection question. First of all, there's not one before us. And secondly, if there was, I'd have to consult with my colleagues because it would be a case in front of us, and I don't speculate on cases either when they're being filed or when they're potentially. So with that, if there are no other questions, thank you very much.
Thanks, Chief.
Thank you.
Chief, thank you very much. I have a few points. I want to assure everyone, and we have talked to everybody that would know about this, that the grocery supply chain is doing well. So you don't have to think that the food's going to run out in the grocery store. I know people have been concerned and buying a number of items, but things are still moving forward. The MCELROY bakery is still going, and all the transportation is still going. So everything is fine, and that certainly will all be a priority as we move forward. So next, let me say that the illegal internet cafes, as of right now, we're closing them. And even if you think you're internet cafe is legal, it's closed as well. We received complaints from local officials that we have people gathering there, and so I just want to make that very, very clear, and we are issuing an order to that effect. In all seriousness, the concern is always the same, and it is number of people coming together. We've heard concerns raised by local government officials and questions in regard to can they conduct their business remotely. This is something that the General Assembly will take up next week. I would suggest that all local governments get ready to do that. Obviously, they need to comply and make sure that the press is notified, make sure that not only is the press notified, but they have access to watch, see what is going on. That's important that during this time of crisis that the public confidence remain strong, but we also know that gathering people together is not something that we would like to see. So the General Assembly will address this, I believe, next week. Let me call everyone's attention to a directive from the PUCO that came out last week, and I think because of all the other things that have been going on, it may not have been as widely reported as possible. So I want to emphasize this again. They have issued a moratorium in regard to electric and gas disconnects. At least for the time being, that runs through May 1, I believe. I'm sure that might be addressed in the future, but I want to make that clear. I know there's been concerns, and some people have asked me about that. I also have received some requests, and I know Dr. Acton will talk about this, but the requests are, what do we tell families who are thinking about going on their spring break? What do we tell people who are already in their spring break and are coming back from Florida? And we'll start with those coming back from Florida or any place else. We welcome you, but the most prudent thing to do, and again, Dr. Acton will address this, but the most prudent thing to do if you've been traveling, please, stay in your home. Please, make sure that you're not in contact with people outside your family that lives in that home. That is certainly the most prudent thing. We have had an example yesterday of someone who very innocently came back from spring break, was in Florida, and that did not end the way we wanted it to end. So we would also say that as far as anyone thinking about traveling, please reconsider that. It is a high-risk proposition, and we would hope that you would not do that. When I got home last night, I think one of the first things Fran said to me was that before I announced that people should be getting thermometers, I might want to check and see if those thermometers are available. And it is true, and I've gotten also other calls. So we know that they're in very, very short supply. But let me try to put that in context. Really, what I was trying to say very inartfully was that employers that continue to work, and we have essential industries that absolutely must continue, we would ask them to be extremely careful with their employees for the benefit of the employees, the benefit of everyone. And so, doing the extra sanitation, doing all the things that you need to do, taking temperature was one suggestion, but I know that thermometers are hard to get. But, it would be a good idea, for example, ask your employees, did you take your temperature at home, for those who do have one? And, ask about how well the employees are feeling. Clean, disinfect. And again, what we say all the time is just separation. Try to observe in the workplace the same separation that we're trying to observe everywhere else. Again, it comes back to small small decisions that each one of us makes every single day is going to determine how well we do and whether our healthcare system actually can hold up under what is coming ahead. Every day I get rumors and I get texts and emails and calls. So let me do my daily National Guard rumor put down. The National Guard is not involved in carrying weapons. You may see them carrying groceries. They're helping at the food bank. And so you're going to see the Guard involved in transport. You're going to see them involved in doing things that they can do with their equipment. When there's any change in that, if there is any change in that, we certainly will let everyone know. So again, I want to make sure everyone understands. Again, rumors about martial law, quarantining everyone in their home, none of those are true. And again, as governor, I think it's important that I kind of put that down. I've been made aware that there are scam artists, and it's the most despicable thing. Every time there's a crisis, every time there's something tough that goes on, after a tornado, for example, there's always scam artists. There's always someone trying to rip somebody off. Small number of people, many of them, I'm sure, they're on the internet. They're not even live in Ohio, may not even live, we don't know where they live. But if someone's on the internet trying to get your personal data, do not give them your personal data. It's basically our same basic rules that we have had in the past. I'm now going to introduce several members of our cabinet. Let me start with Maureen Corcoran. Maureen is our Director of Medicaid. I picked her for her expertise in this area, long standing. She's been really an incredibly compassionate, dedicated public servant for over 30 years, focused on some of the most vulnerable populations that we have. The person who runs the Medicaid department runs a very, very significant department. She has a nursing degree and MBA as well from Case Western. After nursing school, she moved to Cleveland and has lived in Ohio since that time. Maureen? Get my stuff out of your way, Maureen.
Thank you, Governor. As Governor said, my name is Maureen Corcoran. I'm the Director of the Ohio Department of Medicaid. Medicaid is a health care program that serves about 3 million Ohioans, about 1.2 million of whom are children, and that includes more than 210,000 Ohioans who are over 65 years old. We support and care for Ohioans in all manners of healthcare environment and community environments, including 60,000 older Ohioans who are served in home and community-based services in their home, more than 41,000 Ohioans with developmental disabilities who are served also in the community, as well as more than 50,000 Ohioans who are served in Ohio's nursing facilities. You've heard the governor and Dr. Acton say in recent weeks that Dr. Acton is the doctor for Ohio. She takes care of the public health of all Ohioans. And as a nurse, I feel like I share that responsibility to care for all Ohioans, even though I have a responsibility for just a small number of those Ohioans. Today, the governor is issuing an executive order that will authorize emergency rules that will dramatically expand access to medical and behavioral health services using telehealth. I want to talk to you a little bit about what that means and why that's important. So telehealth services includes not only fancy video capacity that we know we have in some of our wonderful healthcare facilities and practitioners, but it also includes simple things like telephone calls, landlines, FaceTime, and the use of simple smartphones. Today, we're expanding the ability to access Medicaid services through all of those venues so that you or the patients that you serve can be cared for or can contact you from their home, to not have to come out to your office, not have to go to the emergency room, and not have to go to the hospital because of concerns with their health. To be served by telehealth or to be served in this manner, the individuals do not necessarily have to have an existing relationship with a doctor. They don't have to be an established patient. So if you are an individual and you haven't been signed up or aren't cared for with a primary care doctor, you can do that now, and you can do it from your home and in these simple manners and be able to get the kind of consultation or reassurance that you need. We've further expanded it so that there are no limitations on practitioners or sites where a patient can be consulted. It includes professional physician groups, federally qualified health centers, rural health centers, ambulatory health clinics, hospitals, emergency rooms, and other, say, community behavioral health centers. And just to give you a sense, it's not limited to just physicians and advanced practice professionals. It includes certainly physicians, psychologists, physician assistants, clinical nurse specialists, licensed independent social workers, licensed chemical dependency counselors, other kinds of supervised practitioners, audiologists, occupational therapists, physical therapists, speech and language therapists, and practitioners who serve our children through our Medicaid school program, as well as dietitians and other providers that we might need to designate as we go forward. The kinds of services that are available through this mechanism include a virtual check-in with your physician or with other of the qualified health professionals that I mentioned, remote evaluation of a recorded video or an image of something on your body that you want your practitioner to look at, for example, online digital evaluation and management services, remote monitoring of physiologic parameters such as heart rate, electrocardiograph readings, things like that, that your practitioner can check even, again, remotely and through these mechanisms. Certain occupational therapy, physical therapy, speech language, and some of these other therapies, as well as medical nutrition provided by a dietitian. In addition to these physical or healthcare services, behavioral health is another very important component of this that the Governor and Director Chris have talked about in recent days. The Department of Mental Health and Addiction Services is coordinating with us to implement a similar expanded array of services and providers throughout our community behavioral health services across the state. And that includes things like treatment, counseling, crisis services, in-home behavioral therapy for children, psychosocial rehab, peer recovery, and other kinds of affiliated services. Now, before I leave, I want to take us back to the basics for just a moment. Enabling this full array of services, both medical and behavioral health, to be done remotely or through phone or video is an important way for us to take pressure off of emergency rooms and hospitals while allowing Ohioans to be able to continue to receive good quality care and to not have to even leave their home to do that. We also know that there's difficulty with access in certain remote areas of the state, and so this is a perfect time for us to be able to make new and better inroads to providing services in those areas of the state. And most importantly, it allows us to protect families and health and behavioral health practitioners from contracting or spreading the virus. Now, while these are important rules as it relates to Medicaid and community behavioral health funding, this is important to everyone. The governor has been communicating with other insurance companies and community providers across the state And from my conversations with them, private insurance companies are even also following in this path. They're taking our lead and beginning to also expand telehealth services in other ways. So it's not just limited to our service. So it is very helpful with this COVID crisis. In fact, it's a necessity. But as they say, necessity is the mother of invention. So I would offer to you today that this is not only helpful in our crisis, but it is also a way for us in our healthcare system to leapfrog forward, to take advantage of the crisis and begin to provide healthcare in a different way that will be satisfying and more accessible and reachable to many Ohioans. Finally, I want to thank the Ohio professional boards who worked with us, Counseling and Social Work, Marriage and Family Therapist Board, the Speech and Hearing Board, the Medical Board, the PT and OT boards, who worked to revise and look at their requirements so that all these requirements would align and practitioners would then be able to take full advantage of the flexibility. And we're also very pleased to have the Centers for Medicare and Medicaid Services and other federal agencies who similarly are making changes in their policies that are enabling us to do this in a much broader and widespread way. So with that, I close by simply saying that while we're all dealing with the events associated with this crisis, it is still very important that people continue to be in touch with their primary care doctor, and this is a new way, a new opportunity both for practitioners and for consumers that we hope you'll feel you can take advantage of.
Thanks, Maureen. URSEL McElroy is my director of the Department of Aging, very important department. She worked for me in the Attorney General's office for a number of years where she ran our Elder Justice unit. She has over 25 years of local and state experience in the aging as well as youth services area. And she is from the Mahoning Valley. She is from Youngstown. URSEL?
Okay, thank you, Governor, and thank you to my colleagues, and I'm excited to be here today. As Director of Ohio State Unit on Aging, I have the opportunity to represent 2.8 million older Ohioans in the state, and for those of you who may not be aware, we have the 6th largest older adult population within the nation. And within our department, we have responsibility for many programs, policies, and services that impact older Ohioans. And we've been focused on older adults since this COVID-19 occurrence has hit our state. In fact, we've been watching it, we've been paying attention, and we've been really locked in. And there's been a lot of attention on older adults because we know they are one of the very high-risk populations during this time. Much of our discussion has been around our nursing facilities, but what I'd like to do is just give you a really quick snapshot of what this means, the impact of COVID-19 for older adults across the state, both within our facilities as well as within our communities. As I mentioned, nursing homes received a lot of attention first because we know that older adults are at risk and because we know that this is a congregate site. What we also know about our nursing homes is that they train for this type of situation every day. They know how to apply precautions and prevention controls, and they know how to bring calm, and they know how to face these really tough decisions. And our job throughout this time has been to listen to them and learn what we can do to help them and support them. Help them in this very fast approaching and fast moving occurrence with COVID-19. In the nursing facilities, we have helped by providing guidance. We've also moved through the continuum, and we've limited and restricted visitation in our nursing homes and long-term care facilities. We also help by monitoring the consistency of the delivery of needed supplies of the facilities and tracking the available workforce to ensure the residents are able to get the care that they need. And we've also formed a special team focusing on COVID-19 and how we will respond within our nursing facilities. We also have on our continuum that we're keeping our eyes on are our senior congregate housing settings. We have tens of thousands of older adults in congregate settings, many of them residing in our affordable housing communities. Many of them live independently, but they're only able to do so with the help of different service providers. And we are strategizing now to see how we can continue to provide services within these settings while minimizing those opportunities for congregation. Other vital services that we need to have discussion about and for people to have full appreciation on in terms of the decisions that we have to make are our senior centers and our adult day centers. These serve as central hubs for many people to receive support, meals, and in some cases, really basic supervision. But these are also sites where people have to congregate. And so I would say to individuals that are using these sites or families that are using these sites, we recognize the importance of them and how they provide a very necessary service for your loved ones. But I would encourage you to begin to think of alternative ways that we can provide these services for them. Within our department, what we are doing is looking at how we can begin to transfer those meals that people get in congregate sites to now home-delivered meals and other options for people, so they don't have to concern themselves or worry that they will not have a meal. And we are also now moving at a really rapid pace of making some really important decisions on essential services, because what we have to appreciate is as many people who typically congregate now will be at home, we now have to find a way to be able to provide those services to meet those needs in home settings. And so meals, we believe that there will be an exponential need for home-delivered meals. We also know that we will have needs in terms of essential services such as personal care, those services where people help individuals with basic needs such as changing them, helping them to get up, helping them to bathe when they need it, in some cases feeding individuals. And so we have to be prepared both within our facilities but also outside of our facilities so that we can provide people with the very basic things that they need. And with that, some of the decisions that we have to make, some of the things that we have to contemplate, are the services that we can offer, but also being able to provide the support for the workforce that will be needed to provide these very critical and basic things for these families. I would like to say that as we continue to contemplate these things, as we continue to work with our sister agencies to help us through these I think pretty challenging times, but times that we know that we can make it through. We are very energized by the local communities, and I'm also very energized, and I think it's important for you to know and understand that the Aging Network is a very sophisticated and a very well-operated and mature network. And while we will be challenged to do this, we know that we are absolutely up to the task. We will have to call upon the support of others. We will ask for support from our federal partners, our state partners, and our local partners. And so if you're wondering what can you do right now, I'm going to leave you with yes, I'm going to give you a plug on what I need from you, right? So that we can all get through this together. One thing, we've heard a lot about distancing, and I heard Dr. Acton, my colleague, say the other day that it's really important for us to talk more about physical distancing, not social distancing. So call someone up, use video calling if you can, but check on your older loved ones or your neighbors. It is so critically important at this time. Ask them how they're feeling. Are they eating? Do they have the things that they need? Offer to go to the store for them and run errands for them if you're able to do so. If you're able to pick up medication for them, please do so. If you have things that can help them in terms of entertainment, I would ask you to provide them with those things. And if you must visit them, if you must, certainly I would ask that we use our basic common sense. We wash our hands, we check ahead, and we make really smart decisions before we make a decision to enter into someone's home. If you have questions, always go to the website with coronavirus.ohio.gov. And in your local communities, I would also say that we have frontline support through our Area Agency on Aging network. Every county can access one through our regional network of aging offices. But just know that you have a very strong network here in Ohio. You have a very dedicated network in Ohio, and we have already made great strides in being able to do business a little differently so that we can take care of the individuals both within the facilities and those also outside of the facilities. Thank you, Governor.
Thank you. Good afternoon, everyone, and thank you to my colleagues who just do amazing work every day, even before this began. It's just such an honor to work with them. Today I'll start with our numbers. As of this afternoon, we do have 119 confirmed cases with an illness onset range of February 7th to March 18th. And our males and females are at 43 of those cases and 76 males. Hospitalizations are 33. And I have to say, our healthcare system is very top of mind for me right now. We have 24 counties accounted for on that list, so that list is growing as well. I want to thank everyone who's heeding the urgent call by our governor and our lieutenant governor and following everything that we have asked. We know this is a difficult time, but as Dr. Collins recently said from the NIH, we are definitely on the upslope now. And it is urgent for those of you, and we all know some folks in our families or people in our communities, try to talk to each other. It is time to heed this call. You need to stay home. If you can at all, stay home with your family. You need to follow the guidance that we have provided and take it seriously so that we can protect our essential workers. Every day matters, and as news will be breaking over the next 24 hours, I think that will become increasingly clear. We've heard in the media about a child care center. We have heard now about a nursing home. You're seeing what is that community spread on the upward sweep. So every day and every one of us matters. I know it's a lag time for each of us in understanding this, and it's kind of a 2 steps forward, 1 step back, and it happens even amongst our own team that getting your head around this is hard. Each of us hears it at a different time. Director McElroy shared with me her son Darian, who is 26, like one of my sons, and didn't matter what she said, but then Kevin Durant is ill, and all of a sudden the light bulb went off. And that's, it's for real. You get real when that moment happens. If something jars it for you, but you go 2 steps forward, and then you're like me driving to work going, this isn't real, but where are all the cars? And it just goes like this. I don't care if you're leaders, whether you're mayors, whether we're citizens, we all get this, and we kind of get it, and then we forget. And I'm asking folks to really heed the message now, because time is of the essence. Spring break, that's a question many have asked about. Come home. For those of you who have been out, young people, take this seriously. As Dr. Burke told us at the presidential address today, young people are turning out from the data we have to be equally affected and hospitalized in large amounts. In Europe, the United States, over 38% of hospitalizations are now under the age of 55. Our average age of onset, so that's skewed from our 2-year-old to our 91-year-old, is 49 years. And young people are getting ill. So you have to take this seriously, and you have to help us not spread this virus. For the rest of us, there are a couple other things I want you to think about. First of all, there is a lot of misinformation out there. It's vital that you go to our website and use trusted sources of information, coronavirus.ohio.gov. There are a lot of scams out there. The Attorney General mentioned them today, so please pay attention to that and never give your information. Stigma is something that is also on my mind. It's been on my mind since the beginning. Remember that this virus began as a zoonotic disease going from animal to human in China. That can happen anywhere. Viruses do not discriminate. They love us all equally. And we have to really think about this. I've heard of things being said that are just not true, and we all have to take this seriously to not spread that sort of misinformation. But also, I don't want people to feel the stigma of getting help. We now know the unemployment numbers. Our Lieutenant Governor will talk more and more about this in the days to come, and all that we are doing for vulnerable populations, like the homeless and others, but also for all of us. Matt Habash of the Mid-Ohio Food Collective said on a show last night, he's been in this field forever, we cannot, just like Pearl Harbor or post any war, we cannot feel badly if we need help right now. There is help. Our philanthropies, our nonprofits are coming to the table. They are doing this, but all of us should not feel any sense of shame of getting a little help or helping each other out as neighbors. There are everyday heroes everywhere. We know that not all heroes wear capes. You're going to hear more stories about ordinary people doing extraordinary things. One of the things that you can do now is donate blood. If you're healthy, you can go to redcrossblood.org. We'll have that on our coronavirus website, redcrossblood.org. Or sometimes if it's not Red Cross in your community, it's your local blood center. That blood will be needed. You don't go when you're sick. Viruses aren't transmitted that way. So we will need the blood supply, and that's something else folks can do. We need to have some grace with this. I constantly say that we're going to get this about 80% right. This is a moving train that's moving very quickly. We cannot linger on things like, do we have enough tests or don't we? At this point is the time for action, and I need everyone to focus on following what the governor says and staying home and taking these actions as we go up on this curve. Asking for grace. Even me, I know people are saying I'm so nice. I have a little fierceness in me. We should just admit it. I even lose my temper, as my kids and family will tell you, when pushed far enough. And we're all asking for grace with each other in this time. We have got to keep planting that flag. My job is to keep pushing us forward, and I'm putting that stake in the ground, and we're moving us forward, and we're all kind of lagging, and it's going to be a little messy. We're inventing systems that never existed before. As we go, we're inventing solutions. We're inventing new swab techniques. We're going to keep inventing in Ohio, and we're going to keep moving that flag forward. And the rest of us will follow as best we can, but now is the time to heed. Put that flag out, everyone. I thought that was the most wonderful suggestion by Fran DeWine, our First Lady. I asked my husband to put ours out, and it'll be a little symbol to all of us of what we're doing. Thank you.
Thank you, Governor. Dr. Acton, another great job. As we were discussing yesterday, we always think of ways to explain things, and kind of said, if you love someone, step away. Right?
But we're not going to sing it.
Yeah, we're not going to sing it. We're not going to sing it. Governor asked me to sit in on a call with the President and Vice President and some of the nation's governors and lieutenant governors as we were getting a briefing. They did commit that there are working with the private sector and with some federal regulations being rolled back, a new supply of masks, tests, and ventilators. So they're working hard to get those things, although reiterating what Dr. Acton said, let's don't get caught up on the test piece. Let's focus on getting healthy and getting treatment and all of the things that she has been asking of us. The one update, Ohio did apply with the U.S. Small Business Administration for a request to allow small businesses and not-for-profits in Ohio to apply for low-interest, long-term loans of up to $2 million through the SBA Economic Injury Disaster Loan Program. That request has been approved. It has been approved. The loans may be used by Ohio small businesses and not-for-profits to pay for fixed debts, payroll, accounts payable, and other bills that can't be paid for due to the disaster impact. Loan applications can be completed online at disasterloan.sba.gov/ELA. disasterloan.sba.gov/ELA, or by calling 1-800-659-2955, 1-800-659-2955, and they urge you that you use, though, the online portal, as that will help the process move more quickly. I know that the congressional delegation and the U.S. Senate passed the Families First Coronavirus Response Act last night. The president signed it. Senator Portman forwarded a couple of highlights that he want to make sure that people know, that it will include free coronavirus testing for those who are ill, improves access to paid sick leave and paid family leave, provides additional food assistance to those who need it, enhances unemployment insurance, and I know Maureen Corcoran is very pleased about one piece in there that we asked for in our letter to the president for a better federal share of FMAP funding, which will help us cope with the added costs of committing our services, our vital services, to the coronavirus pandemic. Also included in this was the approval of the SNAP waivers that were requested for food assistance. Additionally, on unemployment, remember unemployment.ohio.gov is the place that you can apply. We have had through Monday, or since Monday, we've had an additional 111,000 claims through Wednesday. So I'm happy to report, while other states' systems have crashed, I want to commend the team, our tech team and our folks at ODJFS for running a system where that has not happened in Ohio. We'll keep our fingers crossed that it doesn't, but that's incredibly important. I know on occasion there have been some drop calls. The system is pretty overwhelmed, but appreciate everybody's effort there. I know that the governor touched on this earlier about the supply chain. I was in discussions with grocery stores this morning. They wanted to emphasize that the supply chain is intact. They are producing just as much bread and rice and everything as they always have, in some cases even more of the things that people want. But because of the excess demand, that's why you don't see it on the shelves. It's not that the supply chain has been disrupted in any way. It's that they can only go so fast, and if we crowd the stores, then we create the problem for everybody else. But we do want to emphasize something about all the businesses that are open. Most of the businesses are open, frankly, are open because they need to be. And we ask every business that is open to care about your employees. You have to care about them. They are a vital link to the supply chain. They are a vital link to the services that people are counting on. Do everything that you can to make that workplace as healthy as you can possibly make it. To that critical workforce, the people that are working in our grocery stores and doing the things, thank you. You are part of the hero story of this. You are doing things that the rest of society counts on. So for the entire workforce out there who is doing what we need to get through a difficult time, we thank you. And to the public, please respect them. We're all going through a difficult time, but these workers at the grocery stores, at the drug stores, at the places that you might frequent out of need, give them personal space. Give them their 6 feet. help make sure that you're protecting them and you're protecting yourself. This is super important that we do this. We're all in this together, as we say time and time again, and as we're out there as citizens, please make sure you're doing that. Was on a call today with several of the CEOs of the banks across the state. They asked me to emphasize to you, stay calm. The banking system is well. Your banks and credit unions are going to be there for you. They said that you can count on them. They are part of the critical infrastructure that we know we have to keep in place. And some of these banks, credit unions, and lenders have already started voluntary programs on deferrals for cars, mortgages, credit cards. Call them. Ask them if they have something like this available for you if you're in need. They recognize that they have a responsibility in the system, and they're all taking it very seriously. On elections, Secretary LaRose asked me to emphasize this, that the solution that he is seeking is not a new election. He's seeking to just merely extend the voting period out of a matter of safety and health benefit to the population to June the 2nd. So that means if you already absentee voted or you voted early, you're not going to need to do it again. This is about extending that opportunity to the people who have not had that chance yet, and we know that the courts and the legislature are going to work with Senator LaRose to make sure that that happens. For employers on job training, we have at workforce.ohio.gov a list of a variety of ways that you can upskill during this time. When we come out of this, the digital economy will be even more powerful than it is now. And having tech skills are going to be really, really important. This is a time to upskill yourself, to use those for employers, use them for citizens. These services are available at workforce.ohio.gov, and I know on the at Lieutenant Gov Husted Twitter site and at Gov Mike DeWine Twitter site. We're going to put all those links up there for you so you can check that, but it's at workforce.ohio.gov. Another thing, I have received some calls over the past few days and says, well, what about this, what about that? When are you going to give us a heads up that this is coming? And you get the heads up when we know it's coming, when the guy standing behind me tells you. He tells you as soon as we know. This is a process that's as transparent and open as we can possibly make it. Governor DeWine doesn't make a decision and then wait a day to tell you. As soon as he knows what we're doing and he's gotten what he needs from his team, he tells you. And so know that you are getting the information as quickly as we can get it to you. Appreciate the great work, like I said, that the people out there in the workforce are doing to help keep our businesses and our vital services alive. Everybody stay safe, and we will carry on. Thank you.
Just to follow up with John, before we get to you, Jim, I also want to thank all our workers who are out there making a difference every single day. This is the Feast of St. Joseph, who's the patron saint of workers. We thank you. We thank you very much for what you're doing every single day to feed us, to clothe us, to take care of us, medical, the police, on and on. So thank you very much. Jim?
Jim Otte, WHIO-TV. This is a question for Dr. Acton. If you've seen the news broadcast, the pictures, the video of all those kids on beaches in Florida, first, your reaction. Secondly, knowing that they are going to return to Ohio, what is your prescription for them and their families? What should we be doing to keep us safe when they return here? That's right. So the first thing, I have 3 children of my own and 3 children. We have an extended family. And so the first thing, I'm hoping it's not my children. So I know how you're feeling, parents, and we know that this is sinking in slowly.
We have travelers coming back. We've had over 355 travelers at this point from other countries. We have the same advice, and it's on our website about returning. But what I need them to do is monitor, self-monitor is the official term, and that means to watch for the symptoms of coronavirus or COVID-19. I want them to be checking their temperature, seeing if they have a cough, a fever, any of the symptoms. I need them to stay home, because I need all of you to stay home if you absolutely can. If they do start to have some of the symptoms, I need them to talk to their primary care doctor, and now potentially through telemedicine, but to let someone know, and they'll walk them through a history, and then you can include that travel. But the fact is, community spread is all over our country. I'd really rather them not being close together, and that's what's wrong with the beach. I want people, there are going to be people who go that maybe have a beach place or something, and if they're there with their immediate family, because I'm talking about tribes now, not necessarily like your blood relatives, but that small group of people, less than 10, that, might be in your immediate sphere that you're kind of riding this out with. If they're out or you're out, my husband's a runner, a longtime cross-country coach, teacher, and, he and the boys might go for a run and they'll be far apart. We might go for a hike, if there's ever a pause here. And so some of that's okay, but it's that crowdedness, that not having that physical distance, and then mixing it up, of course, and spreading amongst all the localities doesn't help. So come home. There are a lot of elderly folks and people who've been snowbirds coming home as well. The same thing, come home and try not to expose other people. Same advice. Thank you.
Thank you.
Kevin Landers, 10 TV. I have two questions, one for the governor and one for Dr. Acton. You had talked earlier today about dispelling rumors, and there are two reports today that a drug for malaria may show promise for coronavirus. And secondly, some people with type A blood are considered to be more high risk for coronavirus. So I'd like you to address those two issues. And then for the governor, when you turn the lights out at the end of the day, do you wonder if you've done enough? For example, do you wish something you did today should have been done a week ago? And I think, for example, we still have daycares that are open and people are still scratching their heads about why those are still open. Thank you.
So I get the easier one. We will not have a vaccine for a while, as everyone knows, even though it's going at record amazing science fiction speeds. But there is some hope, and there have been a lot of trials all over the world of promising drugs, certainly the anti-malarials you've heard with a combination of an antibiotic. There are also some other antivirals, as I've mentioned before, that are being tested. These are also in situations that are unusual causes. The FDA can waive that. A physician can waive compassionate care guidelines that allows them to try some things in unusual circumstances, last-ditch efforts. So there's a lot of that going on. There is some study going on of these antivirals, and we'll all hope together that some of this will work. It'll give us more tools in our tool belt. That said, where we are right now in the epidemic curve, the curve I told you, we are on the upsweep, and we need to follow these same guidelines. That's not going to change for us, and we have to focus. Remember, our testing is for the most high risk right now: hospital workers, frontline workers. Talk to your doctor. They'll talk to the hospital that might be able to do that testing. We're reserving that. Most of us will stay at home, but the 20% who might need hospitalized, we're using it for that. But again, we'll go back and we'll circle around. Right now, we're working on getting our hospitals ready for what we know is coming. And then I'll let the governor speak. Oh, and on the blood, you know what? I haven't looked at that yet, so I will get back to you and I'll have my team take a look at that.
Thank you.
Every night when I go to bed, I think, have we done enough? Every morning when I get up, I think, have we done enough? All day long, I think, have we done enough? And that's a question I ask my team every single day, and I ask myself 24 hours a day. As far as the daycare, daycares, and we'll have more for you tomorrow, but many of the daycare numbers are going down fairly dramatically. People have taken our advice and have used their own judgment and have taken kids home. We are now in the process of determining how many of the kids who are left there represent parents who are vital to our health system, vital to our economy, and those determinations are being made. But you're already seeing a dramatic drop in the number of kids in daycare, and we'll have more for you tomorrow. I will expand it, your question. We are looking, as URSEL said, the director talked about adult daycare, talked about our congregate feeding. Those are already in process. Again, what we're trying to determine is, can we provide people with what they need out of that setting? In regard to food and the congregate feeding for our elderly, that is ongoing. That is being moved away from the congregate out into home delivery. For those local agencies that have already done this and got it done, thank you, thank you, thank you. You're making those individuals safer, and you're still providing that food. For those of you who have not got it done, please do it. We have to get this done. We want to provide the food, but we also need to get them away from that danger of being with so many other people. In the area of adult, when we're talking about not the feeding programs, but the adult daycare, we have people there who have very, very different needs. Some have as URSEL said, some very, very significant needs. And so what we have to make sure is, before we kick them out, that those needs are going to be met every single day. You also have the issue, as we know what is coming, to making sure that a nurse, let's say a single nurse, maybe have no one else in her home, she's got her mom, she takes care of her mom when she's there. Mom has many, many, many different needs during the day, can't be left alone. So these are the calls that we have to make. We need that nurse, but we also obviously want to get the mom in a particular setting so that she is not as at risk to herself and to others. So the whole process is how we move people out from here down to here, but at the same time don't abandon them. And so it's a working process, but it's an excellent question. We'll have more for you on that tomorrow.
Thank you.
Hi, Governor. Molly Martinez, Spectrum News. The governor of New York has suspended all mortgage payments amid this crisis. Is there any talk of doing that here in Ohio?
We've certainly had discussions about everything. Again, these are items, possible items for the General Assembly next week.
Thank you.
Governor Jim Province with the Toledo Blade. The Blade is reporting that there is a presumptive coronavirus death in Maumee. Want to know, first of all, is this on your radar screen, and how long will it take before we know whether Ohio has had its first death?
Yes, this is something that is currently under investigation, and I am aware of it. So I will talk with everyone about that. And again, we need to let the investigation at the local level. Our disease detectives are doing a thorough look into this to make that confirmation. It's, as you said, presumptive, and when we have more, I'll tell you. And I have to say to everyone, you know, this is real. And that's why we want you to take it seriously. We're seeing all the symptoms, the basic sense that we're moving up, and this is accelerating. We knew this was going to happen. We've always said we know this. Wanting to advocate for their parents in a home but can't visit them. This is some of the hardest stuff we're going to face, and so please heed our guidance.
How long would the investigation take place?
I don't think it will take much longer.
And I was notified of that a few hours ago.
Thank you.
This is Jackie Borchert from the Cincinnati Enquirer. I'm wondering how close do you feel we are to a shelter-in-place order? It was reported today that the Illinois governor is considering making such a move in the coming days, and some communities there are doing their own, but also questioning whether that's effective, given it's not a statewide mandate.
Well, first of all, we've already asked people to shelter in place if they can. That's a term. Other people use other terms. Just to put it very bluntly, stay home. We ask people to stay home. Please stay home if you can. I talked to a friend of mine today, and he called me up, and he wanted to see how I was doing. I said, how are you doing? And he says, we're home. We're sheltered at home, he says. My wife and I are. So many Ohioans are doing that. We need more and more Ohioans to do that. But even so, some of this is just terminology. If you get a shelter-in-place order, you're going to still need police. You're still going to need fire. You're still going to need emergency. You're still going to need to eat. I mean, we're going to need a lot of different things that are going to continue to on in this state of 11.7 million people. So some of this is more terminology than anything else. We want people to shelter in place. We want them to stay home. And so, again, I will renew that plea. If there's no reason for you to be out, I mean a real good reason, please stay home. And let me say something to, we talked about the beaches and seeing people on the beach. Not all young people, don't want to say that. But article today I read, I'm sure you saw it, it looked at the number of young people who are in ICU right now, people in their 20s, people in their 30s. So we should not think when we say that it is more deadly the older you get, that does not mean that someone who gets this at a younger age is going to have an easy time at all. We've got people who are reporting literally the account I read from the ICU and talking about that. So look, this spares no one. And again, what I said yesterday, we have it within ourselves in making small decisions, seemingly small decisions, to impact human life. We have it within ourselves to stop it from spreading from one human being to the other. It can't spread from one to the other unless we help it do that. So let's stop helping it. Let's do what we need to do. Let's protect ourselves and protect our families.
Thank you.
Hi, Governor. Andrew Welsh-Huggins with the Associated Press. I did just want to chime in and thank you for these daily briefings. It's very helpful. You hinted at this a second ago with the item about mortgage payments, but with the legislature coming back next week to deal with the coronavirus crisis, I was wondering, as specific as you're able, could you provide maybe your top 3 or 4 wish list for what you would like the legislature to accomplish related to the crisis next week, if at all possible?
Well, we'll give you that list shortly. I don't have it right now, but look, some of this is, emergency power that we simply do not have. That our lawyers tell us we do not have. I don't think any of this is going to be a shock. If you look, I had the opportunity yesterday to talk with the Speaker. We are also talking with Senate President. We're making this list available to the minority leaders. So we will share that with you shortly. Yeah.
I want to add something about the mortgage question. Most mortgages are regulated federally, and the Federal Housing Finance Authority yesterday set a moratorium, I believe, at 60 days for foreclosures and up to 12 months of forbearance. So most of the mortgage stuff at the federal level is already underway, and we believe that conversation's all moving in the right direction.
Thank you.
This is Ben Garber from ABC6 and Fox 28. My question is for Lieutenant Governor Husted. First, you mentioned that you spoke with the President and Vice President about masks and ventilators. Any sense for how many more of those Ohioans might be able to get? And also with unemployment benefits, we've had a lot of questions from viewers confused about who might be eligible, how soon those rules might be changed, how much money they might be able to get now that they're out of work. Can you clarify a little bit about exactly what this might look like moving forward?
Okay. The people that are eligible for unemployment are full-time workers that were recently relieved of their duties and need assistance as a result of the coronavirus or whatever reason it might be. Your business shut down, they can apply at unemployment.ohio.gov. Usually you have to wait a week. You will not have to wait a week to be eligible. We are looking at how we might address part-time employees, because the limit, right now the limit is that you have to work at least 20 hours a week and make, I believe it's, or you have to have worked 20 weeks and made up to $265 a week. We're looking at those limitations to see if we might find a way to accommodate that. We're also asking the federal government to help us with 1099 employees or 1099 filers, which aren't employees but are in the workforce and would not be eligible for unemployment under the traditional system. So that, and if you're an employer who relieves somebody, meaning that somebody, you don't have a paid leave program, but this person is exhibiting signs of coronavirus and you want them out of the workplace for your safety and theirs, they also would be eligible for this. The federal programs that I talked about earlier that were passed in the legislation that the Senate approved and President Trump signed today, we're going to get the rules on that as soon as we can. Most of that will be administered through the Ohio Department of Job and Family Services. As soon as we have that information, we will provide it for you on additional ways people can access those services. The big piece on the President's briefing that he provided was that there is a waiver, and I believe it's N95 masks. Is that correct? N95 masks. They're going to make many of those. Most of those are not used for surgical grade. They're industrial grade, but they've had a waiver to make sure that there's no liability as it relates to those, and that will bring I can't recall off the top of my head, but it's a substantial number into the system that were not there before. Yeah, from the construction industry and things like that. So. That will bring a lot of new masks and PPE equipment on the scene. The private sector, Roche, Abbott Labs, and others have introduced, the President was announcing that they're introduced testing kits that they're going to try to get out to people across the country as fast as they can. And we just got a briefing on that. It's happening. I'm sure that they have a release on the details of what those numbers are.
And you mentioned ventilators as well. Is that right?
They had a whole process that they were talking about with ventilators. I would encourage you to address that with the administration briefing numbers. They have a release out on all that.
All right, thank you.
Adrienne Robbins, NBC4. My question's for Governor DeWine. This comes from our sister station in Cincinnati. They're wondering, have you thought at all about closing some of the campuses, the large campuses like the IRS down in Cincinnati where thousands of employees are continuing to work?
We continue to look at different places and different opportunities to reduce where people are coming together. Again, whether it's the IRS or whoever it is, we're asking them to observe all the safety measures. We don't want any employee of the IRS or any place else to be walking into a situation that is not good. Any of their workers who can work from home, we would certainly ask the federal government to be doing what we ask everybody else to do, which is to let them work from home.
All right, thank you.
Laura Hancock from Cleveland.com. I just have a question about resources at the Department of Health. You guys have discussed young people at the beach, but we really don't know how many of these 119 people who are sick are in their 20s or 30s, 40s, so on. What is your ability to do that? Are you guys just stretched for resources?
Laura, we're putting out the demographic and detailed numbers as absolutely fast as we can. As you can imagine, we're taking in quite a plethora of information. We still give that information at the county level. Local health departments, of which we have 113, are really leading the way in the press releases now. There are certain things that they'll be coming to you with first, and we'll be receiving that. But we are receiving data now from private labs and hospital labs and our own labs. So some of that just takes a while to compile. Thank you.
Thanks. And along those lines, we have roughly 6 hospitals in Ohio that are testing, and Cleveland Clinic and UH can do at least 600, maybe 1,000 now a day. Yeah. Do we have any, like when I look at the national testing situation in different states, Ohio's got a lot of testing compared to smaller states, but I don't know, what's our rate of testing? Do we know?
You know, we have maximized the testing capacity that we have been given, as you know, and we're very blessed to have some pretty amazing healthcare systems, and we did stand up our, what is being called drive-through. It sounds erroneous, but we had, with a doctor's order, testing. As you know, there has been a lack of swabs and some of the media that is actually in the vial that you put it in. So even though we had tremendous capability to test, we didn't have all that. We're making corrections every day. I'll reiterate this one more time. I think it might be helpful, and I'm going to try to put this on our website. We're talking about testing right now and saving our testing capability for those highest risk folks. That will be our hospital and healthcare workers, our hospitalized patients, and those high-risk patients that are, you know, that 20% that are going to be really surging any second now on our hospitals. So we're doing that because we need to protect and know who we need to wear our limited PPE with and use that wisely. And then also those frontline responders, so the firefighters and the police and the EMS. And that's how we're going to triage that. We'll have that on our website. Remember, folks at home, because I know this is scary, and I've had to ask even a mayor, please, but, you know, we could talk about what we have. We have to fight the war we have with what we have. And we will go back forward. And so if you are home and your doctor knows and does a history with you and tells you, ride this out at home, there's no difference in what they're going to tell you to treat it, whether you were tested or not. Even if you were tested, you might test negative because you're too early in your illness. So the lack of testing is not going to stop us from treating you well and treating your symptoms well. So as I always say, we will tell you everything we know as we know it. Please go to our website, listen to your provider, and we will be mapping out our hospitals, our capability as we gather that. We're going to be hearing more and more in the days to come about our hospital capacity. Quite honestly, we're inventing some amazing things as we go, and therefore we'll share it with you. Laura, as you know, we became as transparent as we are. In a weird way, I owe you a thanks, because saying that I was not being transparent, which was like, everyone in my family has to say, stop saying so much. So, you know, but because of that, you know, it really led to this commitment we've made, and we will honor that. Thank you.
Well, thank you for these briefings. Thanks.
Hi, Laura Bischoff, Dayton Daily News. This is a question for Dr. Acton. I was reading that Imperial College study last night on non-pharmacological interventions. Super fun reading. You know, it talks about these home isolation and social distancing interventions that they need to be maintained until a vaccine is available, maybe, which could be as long as 18 months. Can you give us a realistic time frame of, you know, how long you think Ohio's going to be in the situation that we're in?
So, you know, I think everyone definitely, you know, if you're following the news at all, you know, we need to realize that this is a long haul. But I think we have to take it as it comes, because so much will evolve. If some of these drugs that we're testing make a difference, that will be a new tool in our tool chest. So you're going to see us take the best science, which is the non-pharmacologic interventions, those 4 things I mentioned before, the early targeted layered interventions. Rewind back to one of these earlier press conferences to learn more about that. That's what we're deploying right now, but that will depend on so many different factors. The other thing, and you're going to watch China go through this right now, how do you exit that? Like, how do you peel back those layers without creating a surge of infection? And I beg, you know, we have a lot of ideas. I've been talking to a lot of scientists. I'd love to be a part of conversations, because I'm sure they're going on all over the world right now. But I think as our testing, this is where our testing, when it ramps up, will be invaluable, because what we need to do is do sort of a monitoring, a health monitoring of our whole population. And there will be tests that can look back at blood. So there are a lot of innovations. Again, this is an unprecedented situation. And so there will be some strategies that are going to help us walk out of this time period. So stay tuned on that. You know, I know when you hear words like 18 months, that it just adds a layer of just impossibility. This is the art of the possible. An old mentor from the Columbus Foundation, Dreg Kryler, had this beautiful poster that I still keep with me every day about the art of the possible. And there's so much possibility in what people are discovering right now. So nothing's for sure, and everything we do every day makes a difference, and that changes that curve.
Thank you.
Governor, I'm told I have the last question. Andy Chow with Ohio Public Radio and Television State House News Bureau. There are private, quote-unquote, non-essential businesses out there that say that they cannot close unless you tell them to close. Do you see that to be the case, or is it on them? Is it an individual's responsibility to close if they think they should?
Look, we're happy to talk to any company like that. We have, had situations in the past when we started through this. Some of the early decisions, we were told that, we would tell somebody to close, and they said, well, you have to order us to close. And they had some legal reasons, insurance reasons, other reasons. So we're open certainly to discussion. I mean, the ultimate goal here is to keep people safe. And if that fits in with keeping people safe, we're happy to talk with them.
Thank you.
Thanks, Andy. Thank you, everybody.
We have lots of new information coming out from Governor DeWine and his coronavirus task force on how the virus is spreading here in Ohio. Quickly, a couple of highlights. He is taking measures to reduce the jail population. The internet cafes will be closed. The National Guard is going to be helping food banks. There was a warning issued about scam artists. Don't give your personal information out to just anybody who calls. They're expanding medical and behavioral services using telehealth here in Ohio. The Ohio Department of Aging will be ramping up home meal delivery and personal care. Also, there's an urgent need for blood. So if you're healthy, they're asking that you make an appointment and donate blood to the American Red Cross. And finally, if you need help, they say there is no shame for asking for help, whether it's for food, whether it's for mental or health benefits. Reach out and ask for that help. And finally, please stay home if you can. Our entire news team covering this story for you. Anytime we get a major update, we'll send out an alert on the ABC6 News app. You can also get updates on our website. We'll see you at 5.
It was September that he was not living there and not paying rent. Now, when you lived there, Mr. Allen, did you pay August's rent?
I did not. We had an agreement in August that I would move out so that she can move the new roommates in on September 1st, and I would take over the remaining balance that we owed for the utilities, and she would keep my deposit.
Did you pay July's rent?
Yes.
Is that correct?
He was behind in rent, so no, that is not correct, Your Honor.
Well, what month was he behind in rent?
It was July, and it was August.
Just a second. August, we understand that he didn't pay.
Correct.
In July, what was his share of the rent?
We were supposed to split it in half. It was $1,200 each, and he didn't pay the full amount for July.
Okay, do you have proof, sir, that you paid July's rent?
I have proof that I paid $800 of it.
So you were behind $400
well, I paid
for July.
I paid it, but I had closed the bank account, so I don't have access to that account anymore.
Yes, you do. You're not talking about July 1912.